Hi, welcome to a Physionic detailed study analysis. So today we're going to be going over 7 different studies on the topic of nitrates and blood pressure. So we're going to see how supplementation with nitrates, specifically in beetroot juice formulations, but also just as nitrates, if that has an effect at lowering our blood pressure. So we're going to be looking at these 7 studies to determine if it has an effect in hypertensive individuals, so people with high blood pressure, as well as people who are already controlling their blood pressure with medication. Does it still have an effect? Does it have an effect in diabetic individuals? As well as the mechanisms. So we're going to go into the cells themselves and actually determine how nitrates are proposed to have this effect on blood pressure and how much of an effect. We're also going to cover that. So it's going to be a lot. It's going to be a lengthy video. It's going to be detailed, hence the name. And it's going to be a lot of fun, assuming that you're interested in these kinds of analyses. If you just want the answers, you can jump to the conclusion sections, but you will miss out on a lot of the context, so just be aware of that. If you're not familiar with who I am, my name is Nicholas Verhoeven. I'm a PhD candidate in molecular medicine, and this is what I do. I take studies, I aggregate a ton of studies together, and then I analyze them. I break them down individually and in an open format like you're about to watch. So with that introduction out of the way, I think we're ready to move on to the actual content, to the actual covered topics. So I mentioned some of these already. So how nitrates affect hypertensive individuals, people with high blood pressure, as well as if you're controlling it with medication, as well as in diabetics and the mechanisms. So this is all covered in the public version of this video, but if you're part of my insiders program, you also get access to the correct dosing amount. So how I do this is I take all the studies, so all 7 studies, and I essentially take the amounts that they take for each one of those studies, pull it all together, pool it together, and then I come up with the appropriate dosages that were seen to be effective, the most effective. So if you want access to that, as well as a really interesting finding that essentially could nullify all the effects that we might see, assuming that there are effects. I think you can probably guess that there are effects. There's this one thing that people can do sometimes that will nullify all the effects. And it's something that I did not expect to find. But anyway, I found it kind of comical and also super interesting. So if you want to know about that as well, please join my Physionic Insiders program. And as well as the effect that nitrates have on other blood marker levels, so cholesterol, triglycerides, and blood sugar, specifically in diabetics. So if you're interested in having access to all the topics at once, then certainly join over on my Insiders program, and you'll get access to this video as well as many, many other benefits, which you can read about once you go over to that page. But assuming that you're just interested in these public topics, then let's go ahead and jump into it. All right, so we have, as usual, we have these studies, which I've outlined here. You've got numbers for each one of the different studies. So we're starting out with study 130 all the way up to study 137. And I'm going to go over the funding sources once we get to that point. So with each one of these studies, I will have a very brief description of where the funding came from in case somebody is interested in that. So as we go through each study, I'll mention the funding. But before we get to the actual data analysis, I think it might be important to understand the mechanisms, right? Physionic is built on this idea of macro to micro, so understanding how things function. So with that said, let's go ahead and do exactly that. All right, so to give you a baseline on exactly what we're looking at here, we're trying to understand the effect that nitrates have on essentially nitric oxide. So nitric oxide is kind of a derivative of nitrates. So you go from what's known as a nitrate to a nitrite, and then you go and end up with nitric oxide. And that's what I've got displayed here. So in healthy individuals, if you were to zoom into a blood vessel, so let's say an artery, and cut it in half, so down the lengthwise, then you would find this kind of image. And you would see, obviously it wouldn't look cartoonish like this, but bear with me. And you'd have a certain amount of nitric oxide that's floating around in your bloodstream. And that actually ends up being considered healthy. Now, the reason why that's healthy I'll explain in just the next slide. But hypertensive individuals, or people that have high blood pressure, they tend to have lower levels of this nitric oxide. Now, it's probably not the sole reason why they have hypertension, but it is one of the reasons, one of the contributing reasons, probably one of the chief main mechanisms for why they have high blood pressure is because of this lower level of nitric oxide. Okay, so let's come to understand what exactly nitric oxide does. So here we've got our blood vessel. Again, this is in a healthy situation, and there's a very thin lining of these cells that are found on the blood vessel wall. And these cells are known as endothelial cells. They're a bit like conductors. They essentially tell other cells around them what to do, and they sense the environment within this area. So there's blood flow flowing through this tube, through this artery, through this vessel, and these endothelial cells will sense what's going on in that bloodstream. And these endothelial cells release nitric oxide. So this nitric oxide then can bind to another grouping of cells known as smooth muscle cells. Now, you may be aware of skeletal muscle cells, which are the ones, when you're lifting weights and whatnot, you're contracting your muscles. Those are skeletal muscle cells. We're talking about smooth muscle cells. They're similar, but there are some distinct differences. We won't be going into those differences right now because they don't really add to the overall story that we're trying to get to, and it's going to lead us down some tangents. But the way that the blood vessel is regulated in terms of the opening or the closing, the tightening of the blood vessel or the opening of the blood vessel to control your blood pressure is through these smooth muscle cells. So the smooth muscle cells can contract together, which then tightens the blood vessel. It vasoconstricts, it constricts the blood vessel. Now, on the other hand, it can also relax. So each one of these cells can relax and open up, and this actually opens the blood vessel as well. Then nitric oxide, the way that it plays into this is once the endothelial cell releases nitric oxide, it can bind the blood vessel and lead to the relaxation of that blood vessel. So you can imagine if you have a set amount of volume in a network of tubes, and then you were to constrict all the tubes, suddenly there's a less space for that volume, for that blood to occupy. And therefore, you get an increase in blood pressure. Now, if you were to relax the tubes and you were to then allow that blood to take up more room, then you get a reduction in blood pressure. And nitric oxide does that process. It reduces blood pressure. And the endothelial cells can sense that. And if you have too much constriction and start to release this nitric oxide. So that would be in a healthy situation. It's constantly modulating the amount of nitric oxide that it releases. Sometimes it releases more, sometimes it releases less. So what actually happens? So at this point, we know that nitric oxide is released by these endothelial cells. Yes, it binds and affects and can enter the smooth muscle cells, but what's actually happening within the muscle cells? Now, this looks a little bit complex, a little bit haywire, but it's relatively simple. What's actually happening is here we've got our endothelial cell. It ejects some nitric oxide, it produces some nitric oxide, releases it, and here we've got the inside of a smooth muscle cell membrane, of the sarcolemma. And inside the cell, so this is the inside of the cell, this is outside of the cell, this nitric oxide can then enter into the cell, and there it actually binds to a protein known as soluble guanylate cyclase. Now, you may be thinking you misspelled soluble. No, the way it's written is actually soluble guanylate cyclase. So SGC then interacts, because it gets activated by nitric oxide, interacts with GTP molecules, so guanosine triphosphate, which is similar to the adenosine triphosphate that we typically are we consider energy molecules. So when we think about cellular energy made by the mitochondria, as you know, and other processes, but certainly the mitochondria, it generally produces ATP, so adenosine triphosphate. So that's the main energy currency of the cell. However, our body also has the ability to produce, our cells have the ability to produce GTP, which is another form of energy. And we also have UTP. And there's a number of different cellular energies, but the main one is ATP. But GTP is this guanosine triphosphate, which can be bound by the soluble guanylate cyclase and turn it into what's known as a cyclic GMP molecule. So it turns GTP into a cyclic GMP molecule. From there, the cyclic GMP molecule will interact and activate a protein known as PKG. This PKG molecule, you can sort of consider it like a master protein because it has an effect on all these other different processes within the cell. So one thing that it's going to do is activate what's known as myosin light chain phosphatase. And this protein is antithetic to this protein right here. So you can think of them like devil and angel, or you can think of them like brother and sister. And they're constantly feuding with one another in a manner of speaking. Not that these proteins are actually thinking about things. And this myosin light chain phosphatase, what it does is it removes phosphate groups. It removes phosphate tags from other proteins. Now, if a protein is tagged within a smooth muscle, a specific protein that I won't go into, if that protein is phosphorylated, so a phosphate tag is added to it, then that activates it, and then you get the contraction of the muscle cell. So that's one of the behaviors of the muscle cell, of the smooth muscle cell. And if you get that phosphate tag that's added to it, you get the contraction. Now, that's the job of this myosin light chain kinase. It adds that phosphate, and therefore this protein activates the muscle cell. This protein deactivates the muscle cell by removing that tag. So these two, the PKG will activate the inactivator, the inhibitor protein, and will deactivate the myosin light chain kinase, the activator protein. Hopefully that's clear. So those are two of the things that PKG does once this all happens. The other thing it does is it inhibits the intake or the uptake of calcium. So calcium ions, which is the Ca2+, typically will enter the smooth muscle cell and will also help this myosin light chain kinase by contracting the muscle cell. So the more calcium that you have influxed into the cell, typically the greater activity that you see of the muscle cell to contract. However, PKG inhibits this uptake of calcium from outside the cell into the cell. The other thing that it does is it also allows or encourages the removal of potassium. So potassium inside of the cell gets ejected back out of the cell. And what this does is that it maintains what's known as the membrane potential. The cell has to be at a particular positivity or a particular negativity. And if it stays at that level, it's kind of in its homeostatic level. It's quiescent. It's not going to do anything. But if you start to raise the membrane potential, then it starts to activate all of these different systems. So calcium will come in, the myosin light chain kinase will become more active, all these different things will start to happen. So if you can lower the membrane potential of the smooth muscle cell, then you will then be able to keep it in an inactive state and therefore a non-contracting state, a relaxed state. So you're inhibiting the myosin light chain kinase, you're activating the myosin light chain phosphatase, the inhibitor protein, you're inhibiting the calcium from entering, which is a positive ion, and you're kicking out some of the positive ions from potassium. And this all keeps the cell in its relaxed state. So that's how it would normally function. And certainly there's much more complexity to that than what I'm describing, but hopefully this is enough to give you some idea of what's going on within your cells. So what happens when you have hypertension, or one of the reasons that you might have hypertension? Well, you can experience what's known as endothelial dysfunction, where the endothelial cells will start to not regulate correctly and won't be able to produce as much nitric oxide. That's why there's less nitric oxide in this environment with the arteries, and you have less that's released, which means that you have a higher propensity for these smooth muscle cells to then constrict because you don't have this whole process happening. So, because you have the constriction, the arteries are closing in, which means the blood has to fill a smaller area, and therefore blood pressure increases. Okay, so the idea of consuming nitrates is to supplement the nitric oxide that's found in your body. So how does it work? Well, when you consume a nitrate, if that's beetroot juice or some other supplement, when you consume a nitrate, which is right here, NO3, you have bacteria that use nitrate. I believe it's nitrate. Let me check my notes real quick. Yes, nitrate reductase will take this enzyme that's in bacteria and then reduce nitrate to nitrite. So this is nitrate, NO3. NO2 is nitrite. And then once it gets to the stomach as nitrite, then it is non-enzymatically or spontaneously gets converted to nitric oxide. And this is done due to the highly acidic environment that's found in our stomach. Then nitric oxide can be taken up by the epithelial cells of our intestines and can be found in our bloodstream. So nitrate to nitrite through the mouth, that's where that conversion happens. And you have some crossover, like there's other areas of the body where you have some of these conversions, but I'm talking about kind of the common mechanism of nitrate to nitrite through this reductase enzyme that's supplied by the bacteria in your mouth. Then you have the conversion of this nitrite to nitric oxide through spontaneous means, so just the acidity itself with no proteins, no enzymes involved will then be converted from nitrite to nitric oxide, and then it gets taken up into the bloodstream. Okay, so that's the background. That's the mechanisms, understanding the mechanisms from the macro to the micro. And now let's get into the data analysis. So the first study that we're going to go over is study 131. And this was public funding, meaning that there was no industry involvement, no conflicts of interest or anything like that. Usually I'll write out if there have been conflicts of interest as well, because those can be slightly separate from the actual funding source. So it's publicly funded. It's just by like a university, or it might be by the NIH, or it might be some government body that from another country. But ultimately, it's just it's not, let's say, potentially influenced by industry. Now, here's the way that they went about this. They had one group consume beetroot, which is containing nitrates, and another group consume a placebo. This is only in women. However, I don't know the number because they didn't actually mention the number of participants, which is a little bit weird. It's not, shady or anything like that. It's just like, it's almost as if they just forgot to add the number of participants. They also didn't mention the age of these individuals. And all of these individuals had at least 2 or more cardiovascular disease risk factors. So they were not considered healthy. This was, however, randomized. So that's nice to see. It was double blind, which is great to see. And obviously it's placebo controlled. Okay, great. The other thing is that it was 8 weeks long in totality with a 2-week washout period, meaning this is a crossover design study, meaning that you had people that would take beetroot juice for, in this case, 3 weeks, and then they would have a 2-week washout period right here, and then they would be on the placebo group for an additional 3 weeks. So 3 plus 3 plus 2 is a total of 8 weeks. So overall, pretty nice design. However, it would be nice to actually know the number of women and how old they were. Okay, let's look at the data. So one of the things to look at certainly is to find out if the actual supplement worked. I mean, it's one thing to assume that the supplement worked, but did if you supplement with nitrates, do you actually see more nitrates in the bloodstream? Remember, I mentioned that not everything gets converted to nitric oxide immediately. Sometimes you'll find nitrates and nitrites that are also absorbed in the intestinal tract into the bloodstream. So, and then it can be converted later on by the cells inside the body to nitric oxide. And what we find here is that yes, there is an effect, as in like you consume nitrates, in this case beetroot juice, which we see here. So this is the placebo group right here in white, and the black bars are represented by the actual intervention, the actual nitrate consumption. And we see here nitrate levels, and we see 0 all the way up to 600 in micromoles per liter. That doesn't really matter too much. The point is that do we see an increase from 0? So it's pre versus post. So this is pre-supplementation and post-supplementation of both the placebo. So would you expect that there's an increase in the placebo group if they're not consuming nitrates? No, you wouldn't. And that's exactly what we find here. There's no increase. However, pre-supplementation and post-supplementation of the nitrate-consuming group, yes, we do see a robust increase in blood levels of nitrate. So that's really fantastic. Another measure that they looked at was nitrite. So nitrite, again, we don't see a difference in the placebo, and we do see an increase with the supplementing group, the intervention supplementing group. Okay, so great. So at least we know that the intervention is actually ending up in the bloodstream. Cool. Now, the actual outcome measures. What is happening to the blood pressure? So here we've got our systolic blood pressure. If you go to the doctor and they take your blood pressure, you're going to get two different numbers, systolic and diastolic blood pressure. And with systolic blood pressure, that's the top number, so the highest amount of pressure that is being exerted. And the diastolic blood pressure is the lowest amount of pressure that's being exerted on the arteries. And or usually on the aorta, there's a number of different ways to interpret that. But the bottom line is the amount of pressure is from highest to lowest. So systolic highest, diastolic the lowest. And what they found is in the placebo group, there was no effect on systolic blood pressure. And on the systolic for the intervention group, we do see that there's an effect. There's a pretty noticeable decrease. And you can see that these people have pretty high blood pressure. You know, we're sitting at like maybe 160 millimeters of mercury. So it's certainly higher. And then this is a pre versus post statistical measure. And here we've got a between treatments statistical measure. And both of them show that there's a significant effect. Now, in diastolic blood pressure, we see the same result. We see that, again, placebo, no effect, and with the intervention group, we do see an effect. So, at least based off of this study, with some information left out because they didn't offer us with the number of participants, nor did they offer the age of the participants, we see that there is an effect of nitrate consumption. The next study is also publicly funded. This is study 132. Now, this one is interesting because they ended up doing kind of a dual study within one study, as weird as that sounds. So I'll explain what that means. So here they're looking at men mostly. So I think it was, we're going to look at the exact numbers, I believe. I've got that coming up. So we've got 13 men. Again, most of them were men. 53 years of age. They were overweight and hypertensive, so they did have high blood pressure, and they were on hypertensive medication. Then they were put on beetroot, so again, a nitrate supplement, or the placebo. And I couldn't find if this study was randomized or not. I believe that it was, but I'm not clear. No mention of randomization of this study, at least based off of my notes. And it was double blind, so that's great. And obviously we know it's placebo controlled. However, this one was only 3 days. So maybe if we don't see an effect, maybe it's not long enough. That's a possibility. It is a crossover design, or at least I think that it's a crossover design. Again, I've got a question mark here. Yeah, they did mention if it was crossover or parallel, or maybe I missed it. And if I missed it and somebody finds it, please let me know. I'll add an amendment to this video so people are aware. And the crossover design is similar to what we just talked about. So if it is a crossover design. So again, this is the study one within this study. So they're looking at people with hypertension and they're already on medication. Then the other study is the exact same, except they're recruiting 14 men in this situation, again, mostly men, and 49 years of age, overweight, hypertensive, all the same. However, they were not on hypertensive medication. So they're taking nitrates. They're going to be taking nitrates without the help of their medication. And it's the same exact setup, so nothing else has changed on that front. So as usual, I like to look at the characteristics themselves, so to actually be able to look at the baseline value. So this is before they actually end up doing any sort of intervention. They're just taking measurements. And we see that here, why I said mostly men is because there's 10 men in study one, that's with the medication, and study two, there's 11 men and 4 women. So again, it's heavily slanted towards men. And they're slightly overweight. You can look at all of these for yourself. Their LDL is a little bit high. Those kinds of things. Glucose seems to be normal, in the 80s. That's good. And then for those that were largely taking hypertensive medication, so this is before they were, so here they're going to continue to take these medications. And for these individuals, they may have been taking medications and then they're going to be off the medication. So they usually have a run-in period where essentially the researchers tell them, okay, stop taking your medication. Obviously they'd be consulting their physician as well to make sure that this is okay. Because if you have like raging cardiovascular disease, your physician's going to say, no, absolutely not. You can't be part of this study. So the researchers obviously coordinate with their physicians, and the participants also coordinate with their physicians, and they'll have a period like maybe 2 weeks or 4 weeks or something along those lines where they don't take anything. So they stop taking their medication as a result. Okay, so, and these individuals are obviously going to continue to take their medication. Okay, so now this is still the baseline values. So I'm not going to go over all of these because these are different measures of blood pressure, essentially. I'm going to be looking at systolic, diastolic, and mean arterial blood pressure. You could look at some of these other ones like flow-mediated dilation. It adds complexity that we don't really need. But we're looking at once they're separated into each. So now that I actually look at this may have been a parallel design study because if they're separating it out between placebo and nitrate, unless it's still crossover and these values may have changed a little bit. I'm not sure what exactly is going on here. Again, the study design was not clear according to the researchers. So let's just move forward as if it's crossover design, but if there's any added changes, then I'll add an amendment to this video. Okay, so these are the baseline values before they're on nitrates and before they're on placebo. So don't take this as a placebo versus nitrate yet. So this is when they were on the placebo. They had a systolic blood pressure of 132, and when they were on the nitrates, or right before they started taking nitrates, they were on they had systolic blood pressure of 129 and diastolic blood pressure, mean arterial pressure. And then in this group, we see that there are some statistical differences between the placebo and nitrate. So if that's the same group or if those are two separate groups, the point is that there are some slight differences. So the nitrates, before they were put on nitrates, they had slightly lower blood pressure compared to the placebo. So that's something to keep in mind because that could alter our conclusions that we would make on this study, because at the beginning of the study, they are not equal. They're not the same, which typically you would not want that. You would want a study designed to be equal so that any changes that occur, are attributable to the nitrates specifically. So that's something to keep in mind. but there aren't huge differences between these. But we do see it consistently in systolic, diastolic blood pressure and mean arterial pressure. We also see that actually in flow-mediated dilation as well. So it seems like these individuals may have been a little bit healthier maybe than when they were tested here, if that's in the crossover or the parallel. If they're two separate groups, then this group was a little bit healthier. Okay, that said, let's go into the actual blood value. So again, we have to actually measure and see if there are any changes. And I'm going to be focused on a few of these. You can certainly see the data for yourself if you're interested in, for example, like arginine levels or mean arterial pressure. But I'm going to be focused on the main outcomes. And what we find is that the nitrate group, after they consume nitrates for the 3 days and before the experiment, then we see that there is an increase in blood nitrate levels. Great. What we also see is nitrite levels also increase. So it says nitrate here because that's the nitrate group, but they're measuring nitrite over here. And we do see that there's an increase. It may not look like much, but there is an increase. Now, to explain this a little bit, what they're doing is they're connecting the individuals. So this again tells me, I think this is why I thought it was a crossover design study, is because they're connecting the individual when they were the same individual. So let's say John. His name is John. This person is named John. And this is the data point for John when he was on the placebo group. And then, so they collected this data point for John. And then when he was on nitrates, they connected his data point on nitrates to the one in placebo. So you can tell the specific change for John. So in this circumstance, they've got everything grouped together because everybody was very low in nitrates when they were on the placebo, which makes sense because they essentially weren't consuming nitrates. And then once they started consuming nitrates, you can see it all of them increased way up here because they all moved up. They all started to have nitrates in their blood system. However, what's intriguing here, and what you'll notice, is that there's always some level of heterogeneity, meaning that there's differences between people. So if you look at the nitrates, there's essentially no heterogeneity because everyone shot up to here. So if you took this individual and you were to actually tease out which one of these dots was this individual, there's no doubt that it shot up in their blood values of nitrates. However, if you look at the nitrite levels, you can see that this individual on the placebo had this level of nitrite in their bloodstream, which might indicate that they're already consuming something in their diet or something else is giving them a high level of nitrite availability. And then when they start supplementing, they do not see a change. So from here to here, clearly there's no difference. However, this individual, let's go back to John, this individual did see a decrease in nitrites. So they went from a higher nitrite level to a lower nitrite level. And that may be because they started to change their diet when they were supplementing with these nitrates. On the other hand, the majority of these individuals over here did see a slight increase in nitrite levels. So I'm just trying to tease out, and then you've got one person here that saw also a slight decline in nitrite levels. So the point is that this is pretty useful because it allows you to connect who might be an aberrant value or an aberrant, an extraneous variable that you may have to tease out with more data. But overall, the average effect, even with this person not having a change, even with John having a decrease in nitrates, the fact that everybody else, or most everybody else, saw an increase, the average value did show an increase, and that's why it's statistically significantly elevated. Not by much, but a little bit. So this is something that's really intriguing. You can see the same thing happen here if you were to look at L-arginine levels. So largely you don't see much of an effect in most individuals, but then you see this one person that absolutely dives in L-arginine level. I'm not sure what's going on there. You could always speculate what's going on with this person that's not happening with everyone else. Is there something about their diet that may be off? Now, usually people, when they criticize studies, they think to themselves, okay, well, did they control for their diet? And I think that's certainly an important factor. But usually it gets drowned out. And you can see that here largely. Let's say if we look over here, you get drowned out by the sheer number of participants. So most of the participants had a slight increase in nitrite values, but this individual had a pretty dramatic drop. So even if the nutrition wasn't controlled for, it doesn't matter so much when you have a large enough sample size, because these individuals will drive the effect where it needs to be, where it actually is the real effect. Now here, on the other hand, everybody essentially did not have a change, except for this one person had a dramatic drop. You could maybe argue a few other people had a slight drop as well. So it's that kind of context. It's that ability to look at that data and be able to figure out who is driving the effect. How much are they driving the effect? What is the totality of the data actually indicating? It's those kinds of nuances that are extremely important. And that's why I really love the fact that they added the individual values and connected it to the same person when they were on the other treatment. Okay, so enough of me explaining all that. I realized that I went a little bit on a statistical bent there, but I think this kind of nuance is really important, and I think that it allows you to understand my thought process. It also allows you to understand and learn how to think about these kinds of this kind of data and what we're actually being presented with. We're being given additional information so that we can make more intelligent, more thought out opinions on the data presented. Okay, so in systolic blood pressure, we can see that all these individuals, and then we've got all these individuals, and you can see that largely everybody declines, everybody decreases, at least this individual, this individual, this individual. But then you've got this individual that saw an increase with the nitrates. And you saw this individual also see a slight increase, and this individual see a slight increase. So overall, 3 or 4 of the individuals saw an increase in blood pressure, in systolic blood pressure, and the other ones saw a decrease or no effect. But ultimately, all of that average together indicated indicated no change according to the statistics. So if you looked at the average of both data sets, there's no difference between the two. So we can't conclude anything off of this. Now, what would be interesting is to do like a subgroup analysis, a sub-analysis to find out why some people increased and some people decreased. So there may be something in common with those individuals that saw an increase and something in common with the people that saw a decrease. And then we can tease out those differences. But I can promise you there's simply not enough data here, not enough data points here to indicate why some people would see an increase and some people would see a decrease. So as it stands, the only thing we can say is that there's no effect of nitrate supplementation on systolic blood pressure. And you can do the same thing with diastolic. I'm not going to bore you with going over it again, but diastolic blood pressure, again, there's no difference, no effect. You can see largely the effects are pretty mild. And then mean arterial pressure, I said I wasn't really going to focus on that, but you can see it for yourself, also no effect. Wow. Okay, so that was and I should mention after all of that, I should mention this is in study 1. So this is with the people that are taking medication. Now we're going to look at people that are not taking medication. So these are individuals that are not taking medication. Again, we see the same effect. The supplementation sees a robust increase in nitrate levels when consuming. So nitrate group consuming with a measure of nitrate. Nitrite levels seem to increase a little bit more robustly, just a little bit more robustly with these individuals, mainly because they don't have a person, if you'll allow me to go back for a second, they don't have a person that shoots down, or they don't have a person that's way up here. They have everybody largely increasing their nitrite levels. You have a few people decreasing. L-arginine levels, you can see that slightly increases. The systolic blood pressure, now we start to see an effect. See, in the previous, we did not see an effect. Now, because these individuals are not on medication, we see that there is an effect of the nitrate supplementation on systolic blood pressure. So it does reduce it. And some of it could be largely driven by this individual that went from high to much lower. You could look at that. Look at that, 180 millimeters of mercury. That is really high blood pressure. And the nitrates had a substantial effect on their systolic blood pressure levels. Diastolic blood pressure levels, again, the exact same scenario. And mean arterial pressure, we again see that there's a drop in blood pressure. So this would indicate to me that if you are taking medication already, the nitrate values may still have an effect, but we can't actually say that. So if you're taking medication, then most likely the consumption of nitrates will not have much of an effect. Based on this study, we're gonna look at some more and see it, what the averages are, like in the pooling all the data together across multiple studies. But this study would indicate that there's no effect if you're taking medication, and this study would indicate that there is an effect if you're not taking medication already to control your blood pressure. The next one is study 133, which is also public funding, which I mentioned in the first study that we looked at what that means. And here again, we're looking at strictly in men. So we get 27 men. This is a crossover design. And this study was randomized. It was double-blind, as you would hope for. And these individuals were consuming beetroot juice, again, the nitrate, or the placebo. And they consumed it for, I suppose, what is that? 1.5 weeks of one, and then a 2-week washout, and then 1.5 weeks of the other. And they did not know which condition that they were on. These men were 63 years of age, overweight, hypertensive. So you can see a trend here that they're overweight and hypertensive. And they were on antihypertensive medication. So this would apply to the study 1 from our previous study analysis, which was study 132. So we're going to see if there's some congruency there. Okay, I think that's all I have to say on that. Now let's look at the baseline value. So this is just to show you an indication of, like, I wasn't lying to you about their age or anything like that. This is their baseline, where they're at. So their age, the range was 53 to 70 years old. The average was about 63 with a standard deviation of 4.4. Height, weight, I don't really care about that too much. BMI is interesting. Overall, some people were normal weight. Some people were definitely on the more obese side, but they averaged out to about overweight. And some people had normal systolic blood pressure, but overall the average was slightly elevated systolic blood pressure. And you can see that throughout for the rest. Okay, now let's look at the actual values. So again, we're looking at the blood values. So they're looking at plasma, salivary, and urinary. So here they took it to a whole nother level. They didn't just look at blood values. They also looked at what's happening in the mouth after they consume, and they're looking at the effect with urinary. So after processing nitric oxide, what happens, or processing nitrite or nitrate. And then the actual measures that they did was a home blood pressure test. So they just were strapped up to this system that they did like once a day, for example, at the same time every single day. And then the data was then calculated by the researchers, or taken down by the researchers. That was over that 1.5 weeks. I'm assuming it's a 1-week intervention, roughly 1.5 weeks. And then they have an ambulatory, which means that it's just constantly present for 24 hours. So they have their blood pressure measured every hour for 24 hours. And that means also throughout sleep. So that gives you some added information. So we're going to be looking at the regular blood pressure test as well as ambulatory blood pressure test. Okay, so let's go up here to nitrites. So they've got a low nitrate intervention and a high nitrate intervention. So this is technically a placebo group, but the low nitrate is like super low nitrate. So we're talking like multiple magnitudes lower than the high nitrate. So it's essentially essentially not consuming nitrates. And that was actually the case for all the other studies as well. Typically, they just used the same substance For the placebo, just remove as much of the nitrate out of the system as possible, or out of the intervention, out of the placebo as possible. So they've got they've got their nitrate condition, let's say beetroot juice, and then they've got a beetroot juice where they've removed as much nitrate as possible. So you're seeing like a 99.99% drop in nitrate levels, but everything else is the exact same. So don't be deceived by low nitrate as in like they're consuming only half of the nitrate. It's way, way less than that. So this is our placebo group, and this is our actual intervention group. And we find that nitrite levels are 2 versus 5.8. So there's almost a 3-fold increase in nitrite levels in the plasma. Salivary, again, there's a huge increase in the salivary with the intervention group. And again, urinary, we see a lot being excreted through the high nitrate intervention. Looking at nitrate levels, it's the exact same story. I'm not going to go through them individually. All of this is massively statistically significant, and the odds are very high that this is all true. Now, looking at blood pressure, however, we do not see an effect. The reason why I say that is because when they're on the low nitrate or the placebo, it's 127.5. And when they're on a high nitrate, it's 128. I don't want you to think that they saw an increase in blood pressure. It just means that there's no difference. So there's no improvement. And same with diastolic blood pressure. Same with peripheral pressure and heart rate, if you're interested in heart rate as well. No differences. And it doesn't seem to really approach statistical significance. Ambulatory, again, that 24-hour measure, as well as sleep, again, no differences. You could say that maybe it's approaching statistical significance with the ambulatory blood pressure, possibly by an increase in the actual intervention group, which is kind of interesting, but technically it's not statistically significant. So here, again, we see no effect. Heart rate, I just noticed this. I actually missed it the first time. Heart rate, there seems to be a 1 beat per minute increase. Again, these are the kinds of things where you have to look at the effect size and determine, does this actually matter? And my answer to this would be a resounding no. It makes 0 difference. So a 1 beat per minute increase is less than negligible. So this study would indicate, a lot like the previous study, that if you're taking medication, no effect. Nitrate supplementation does not help. Now, this study 135 was nonprofit funding. So this would be, obviously, you know what a nonprofit is. So take that as you will. Of course, I'll link the study so you can look at the actual who the nonprofit was and all that stuff. So this is, maybe you could argue, not quite as good as public funding, but it's pretty close. So here they're looking at 34 men and women in this situation, and there was a range of 56 to 58 years of age. They were overweight, hypertensive, and they were not on antihypertensive medication. So these individuals, we have a situation where this would be like the multi-study study that I talked about earlier, but comparing against the second study without medication, so when people were not on medication. Although that was largely men, this one is going to be a little bit more even, I think. I think I've got that data coming up. And they separated them out, beetroot juice or placebo. And this was a parallel design, so that's why I don't have the crossover design. So they separated 17 people into the beetroot juice condition, the high nitrate condition, and then they had 17 people in the placebo condition. And then from there, they were able to separate out and see what the effect was against each group. So they're not comparing within groups, so they're not comparing against the same individuals, or comparing between groups. And so this was with the no antihypertensive medication. They do another study just like the other study did. They have 2 conditions. So the other condition is going to be very similar, but it's going to be with people using antihypertensive medication. This was also randomized, double-blind, and obviously placebo-controlled. It was 8 weeks long with a 2-week run-in period where they stopped consuming their medications, and then 8 weeks in total, and then a 2-week run-out period. So they measured again 2 weeks later after they'd stopped supplementing with nitrates or placebo to see if there's an effect. And the exact same is true here as well. However, they had people that were on antihypertensive medication, but everything else is the exact same. So another set of people, another 34 individuals, men and women, separated out. Okay, so here, now we actually get to look at the numbers of everything. So the N, so that's the 32 individuals. I think here I've got 34. The reason why they're reporting 32 here and not 34 is because you usually have a few people that drop out of the study. So at the end of the study, they ended up with 32 individuals. And of those 32, 22 were women. So there's maybe a slight skew towards women in this situation with the placebo group. However, the dietary nitrate groups, it was about even. Well, it was even 16 women, 16 men. And it was not statistically significantly different. Age, again, no differences, around 56, 57 years old. They were slightly overweight. For those that were taking hypertensive medication, they were taking one drug, and you've got a breakdown of the different types of drugs that they'd be taking: diuretics, beta blockers, ACE inhibitors, things like that, statins, things of that nature. And then they've got their screenings for the actual blood pressure. So these people definitely had high blood pressure. The average was 148 for the systolic or 149 for their systolic in the dietary nitrate group. And you've got diastolic blood pressure nearing almost 90. So it's certainly high. And then they did a few other measures like cholesterol and glomerular filtration rate, just to indicate their kidney health. If that's interesting to you, now you know at least. Okay, so now, again, we're looking at the plasma levels. We have to make sure we're looking at this. So with the plasma levels, so we're going to be looking at the concentrations of plasma, so in blood, in saliva, and in urine. Again, these people went above and beyond. And then here, it's interesting that they measure the cyclic GMP levels. Let me go back real quick to indicate what that means. Remember this? Cyclic GMP right here. That means the nitric oxide is actually entering the smooth muscle cells, or it's entering cells, I should say, just cells in general, and leading to the generation of cyclic AMP. So a smooth little addition that I certainly appreciate. So we'll cover that as well. So what do we find? We find here we've got our placebo group. So all the white bars are the placebo group. And we've got our pre, so this is before they supplemented with the placebo. The post, so this is after the several weeks on the placebo. And this is the washout period. And the washout period is just the 2 weeks later. They did another measurement after 2 weeks of being gone. You can see there's no changes. That seems pretty self-explanatory. However, when they were supplementing with the nitrate, they did see an increase while they were right after they were supplementing for several weeks. And then after the washout, it eliminated. So 2 weeks later, there's no effect anymore. There's no increase in nitrite levels. So they only measured nitrite in this condition. And you can see that's also true for saliva as well as with the urine levels. Now, if we were to look at the cyclic GMP levels, we see that there's no effect with the placebo group, but we do see an increase in cyclic GMP in the intervention group. So pretty cool. This is additional information to indicate that the nitrate consumption is actually having an effect. All right, so let's look at the actual values. So you might be wondering if this is the people that are still taking the drugs or the people that are not taking the medications anymore. And this is actually a combination of the both. And I did not actually end up adding the data where they separated the two, but I'll tell you what the results were after we go through both. So they did have enough data to separate both the the people that were still taking the antihypertensive medication and the people that were not. In this situation, my understanding is that they're combining both. And here again, they're looking at the clinic, so where they actually go into the lab and actually have their blood pressure tested at the same time, et cetera, same conditions. And then they've got the ambulatory, which is that 24-hour measure over time. And if we look at systolic blood pressure, again, the white is the placebo and the black is the condition where they actually take the intervention. And we see that, again, there is an effect in the intervention group. There's no effect in the placebo group. This is also true for the ambulatory measure. Diastolic blood pressure, there is an effect, but we're not talking about massive effects here. This is a 3 millimeters per mercury effect here. And the same is also true for the ambulatory. Heart rate, not that interested in heart rate, but heart rate did not change. So that would be antithetic to what the other study showed, an increase of 1. But the reason probably why this study did not show an effect is because they didn't have the statistical power to detect an increase of 1. That's where effect size makes a huge difference. And then this is another representation of this data right here, but this is over time. So from weeks 2 to 7, where they're actually consuming each one of these supplements, if that's placebo or not, we see that there is an effect immediately. So in the first week, there's a drop in blood pressure. So this is systolic blood pressure, and it persists throughout the weeks that they're taking it. And then the moment they stop taking it, there's suddenly an increase back up to baseline values. So they stop taking it, I suppose, at week 6, and then it jumps back up at week 7 and 8 to non-statistical differences. Or I suppose there are statistical differences here at the end of the 8 weeks, but it does seem to increase compared to before. So there may be a lengthy effect where it takes a while for it to jump back up, which is interesting. The diastolic blood pressure, the effects are so mild that you're not seeing much of an effect until the very last week, week 6, where they're still supplementing and they see a drop. There's a slight drop in diastolic blood pressure. And you can see that there's still technically a statistical effect here as well, but I'm assuming that's what they're indicating here. So diastolic blood pressure, the effects are extremely mild, and systolic blood pressure, it seems like there's far greater effects. And then heart rate, again, if you want to look at that, you can see, but there's no effect on heart rate, which all of this is all very much in line. Now, I mentioned that I didn't actually end up adding this to the presentation. I think I just simply forgot. So my apologies. But I wanted to report on the data, and you can certainly open this study up and look at it for yourself. I think it's in the supplementary material or further down in the data set. But separating out the people that were not on medication, there's still an effect. There is an effect on the systolic blood pressure. So there's a drop in systolic blood pressure. However, the people that were taking medication, there's also an effect, which is different from what the other 2 studies indicated. And if you're thinking, wow, well, this is super confusing. Well, this is where you have to get more granular with the data. You have to get more nuanced with the data. There's like sub-analyses that have to occur after these analyses that we're doing right now and what the researchers have done. And we're going to get to that. We're going to get to the meta-analysis, which groups all of the data together. So for this study, in both study conditions, you're seeing that there is an effect of nitrate supplementation. Hey, if you're interested in actually knowing the exact dosages and how to take these nitrates and maybe some disadvantages and advantages of certain nitrate formulations over others, then I would strongly recommend that you join my Insiders group or my Insiders program, where you'll get access to that information as well as the complete version of this video, as well as all my other study analyses, the complete version, as well as seminars, as well as live sessions with me in a group setting. You can ask more personalized questions, so you can send me questions that I add to my office hours docket, which is my live session. and a bunch of other benefits that are included in the Insiders program. So again, dosages and all that stuff related to this study analysis you can find there. And with that little bit of advertising out of the way, let's get back into the video. All right, let's get into study 136, which is also not nonprofit funding. So we're looking at 20 men and women, 62 years of age. These were also hypertensive individuals. The study was randomized, double-blind. It only lasted 15 days, which is longer than 3 days, but certainly shorter than some of the 6 weeks and 8 weeks. It was crossover design, so each of the individuals experienced the nitrate condition as well as the placebo condition. Good to see. Now, I tried to fit all the baseline data together. So we're going to start over here. We got 20 individuals, so there was no dropout rate, which is great, which I suppose isn't that difficult considering it's only 15 days. If you're talking about a study that lasts like 6 months, for example, the dropout rate tends to be pretty high, especially so you have to start with a much higher sample size to account for the 20% dropout rate that you might experience. But in this case, 15 days, pretty easy. These individuals were 62 and a half years old with a standard deviation of 13.1. So some people were in their 70s, some people were in their 50s. The number of men of the 20 were 13, so 65% men, so a slight skew towards men. These were overweight individuals. I probably should have put that in the introductory slide. But these were definitely overweight individuals unless they were just massively jacked, all of them, which seems highly unlikely. So they were probably overweight. And you can look at some of these other measures as well. Years with hypertension, 7.5 versus with 7.5 years plus or minus 6.5. The baseline systolic blood pressure was 137, so relatively high, and diastolic blood pressure was 80. Some of them were taking like aspirin and things of that nature, so they were taking some medications for the study, or before the study, up to the study. And you've got a few comorbidities like cerebrovascular disease, so a few like cardiovascular disease potential issues there as well. So we're talking about people that may have had experiences with like strokes or had some sort of issue in the past. And then looking at the nitrite levels, so looking at the plasma levels, what do we find? We find that this is the baseline, so 126 with a standard deviation of 115. And this is after the placebo. There was essentially no change, so up to 131, a change of 5. No big deal there. But after the nitrate supplementation, we see it jumps up to 732, which is a huge increase, and it is statistically significant. So we know that the nitrate supplementation at least enters the bloodstream. Now, to look at the actual data itself, here is something that I should point out because the researchers made a mistake. Which I was really confused. I kept trying to read this over and over and over again, and it turned out that, yeah, the researchers made a mistake. They switched some numbers around by accident. I'm assuming by accident. I don't know why they would want to publish it otherwise, which admittedly doesn't really bode too well in my confidence level on this research, simply because considering it went through peer review, it's kind of hard to miss this, because if you just looked at the data, you'd be able to tell that there was something wrong here. So the reason why I say all that is if, let's say we started at the baseline here, the value is 137 for the 24-hour systolic blood pressure. So this is they're using the ambulatory method where it's measuring every hour for 24 hours. They got the day and the night for systolic blood pressure and diastolic blood pressure. So this is fine. The baseline, let's say it's for 24 hours, it's at the baseline 137, great. But then they switch these two up. So after the placebo, this is standard deviation. This should actually be over here. So the 133 should be under the mean column, and the 7 should be under the standard deviation column. And all of these values should be switched with their respective ones. The other aspect that they missed is that all of these are switched. So the standard deviation here should be over here. So these mean numbers should be under the standard deviation because it's the delta, the amount of difference. So the amount of difference would be over here. And they did not switch it up for this condition. So you can tell that the mean here is 129, let's say, and the baseline is 137, but the mean here is 7. So I'm kind of harping on this, but it's actually a pretty big deal. So here they got everything right. So the mean is exactly where it should be. The standard deviation is exactly where it should be. And the difference of the mean is exactly where it should be. So you can tell difference of the mean is minus numbers here. And here it's difference of the mean, and it's all positive numbers because the minus numbers are all over here. Hopefully that's making sense. You don't really have to understand it to actually understand that there's a problem here. There's a pretty big problem. They mixed up a bunch of the numbers. I don't think that actually affected the analysis specifically, but it doesn't really bode well for a care to detail if on the outcome measures that you're looking at, you've completely switched everything up by accident. But anyway, I digress. Let's just move on. So the 24-hour measure, yes, there is a statistical significance for systolic and diastolic blood pressure, so that there is a difference between the consumption of the nitrates versus the placebo. So placebo is over here after placebo, the difference with the placebo after nitrates, and the difference with the nitrates. And we find that while there's a slight placebo effect, you see that there's a -4. Again, this should be under the means. -4, there's a greater effect with the nitrates. So you get a little bit greater of an effect. And the difference between the groups was about 4.4 between the end result of the placebo and the end result of the nitrates. And what we see is during the day, so if we split the 24 hours for 12 hours of day and 12 hours of night, quote unquote night, then we can also see that there's a statistical significant effect with the day values, but there's not an effect with the night values. So it does not seem to have much of an effect if you're talking about the values at night. Now, that said, however, I should mention that this is specifically comparing the nitrate values versus the placebo values at the end of each intervention. It is not comparing the nitrate values versus baseline and placebo values versus baseline. So if you were to look at that statistical analysis, not that they did it, but if they had, I'm pretty sure that they would have found an effect. But let's just leave it as is. The greater effect is during the day that you see these reductions in blood pressure, which is probably a good thing. So my confidence in this study is pretty low, but it at least indicates similar results to what we've seen in the past. And the next one is to cover study 137. So study 137 is also public funding. So all these studies are either public funding or nonprofit funding, but this is public. Here they did something really interesting, is that they added another condition, and this is parallel design. So they had 48 women, so the majority of the study participants were women, and they had some men that were 60 years of age, overweight, and hypertensive. Where have we seen that before? It was randomized, it was double-blind, and it lasted for 2 months. Great. They had individuals in a placebo group, and then they had people in the nitrate-consuming group. Now, they also had another group, another condition, where they had people consume the same level of nitrates with the addition of folic acid. So, what did they find? And is there an added benefit potentially of the addition of folic acid? All right, so we're looking at the baseline values. Let me remove myself here for a second so you can see baseline values. So we've got 47 people in total. We've got 16 in the nitrate plus placebo. So this is without folic acid, nitrate plus folic acid, and placebo plus placebo, okay? So 16 individuals, and 15 individuals in each one of these conditions for a total of 47. The average age was about 60, and they had 83% women. So it's definitely more heavily skewed towards women with a huge amount. So basically like one guy in the nitrate plus placebo. So this, if you're looking at nitrate plus placebo, it's probably more of only indicating what women would experience in this situation. So it's approaching statistically significant differences, but it's technically not. And you can look at some of these other measures as well. Some of them were pre-hypertensive, so they had high blood pressure, but maybe were not completely hypertensive. Some people had grade 1 and grade 2 hypertension, so they had much higher hypertension levels. And all these individuals were overweight, as I indicated. So, and then you can look at some of the ambulatory or the clinical blood pressure measurements. You can tell that each one of these is pretty high. So they're 140s, 150s for the systolic, and in the 90s, 80s and 90s, high 80s and 90s for the diastolic. So these people are definitely hypertensive. Okay, so here we're looking at the salivary levels, of nitrate and nitrite, and the plasma nitrate levels, and the folate levels as well. So they added that in addition. Remember, this is the placebo group for both. This is nitrate plus placebo, so no folic acid, and this is nitrate plus folic acid. And we find is that baseline 30 days and 60 days, so baseline 30 days, 60 days, we do see that there's an increase in the blood nitrate or salivary nitrate levels and nitrite levels when they're consuming just the nitrates. Now, technically, we also see that at the 60-day mark, but we don't seem to see that when they're at the 30-day mark. So I don't know if that's an interaction effect with the folate, with the folic acid, or if these people just weren't consuming the nitrates. I don't know what's going on here. But we're more interested in this condition where there's a robust increase in nitrite levels and nitrate levels if you look at the plasma levels. So the plasma levels take some time. So that may be because of the amount of nitrate that they consume. I don't know what's going on here, but as it's reported, there is an increase at the 60-day mark. There does not seem to be much of an increase at the 30-day mark, which is antithetic to what we've seen in the previous studies, which have seen changes after 1 week or sometimes just a few days. So interesting. The folate levels did increase folate levels increased in both. In 30 days and 60 days, not talking about both conditions, just the folic acid condition. And what's interesting here is that if we look at systolic blood pressure, we see that it goes from really high to quite an effect in reducing the levels when looking at the nitrate plus placebo, so nitrate alone. We do see an effect, and yet we don't see an effect after 60 days, and we don't see an effect at all when it's the folic acid also consumed. So to me, this would indicate, and I don't want to say believe, but I have some skepticism about something is going on here. It's possible that the folic acid has an interaction effect with the nitrate consumption and therefore slows down or nullifies the consumption of, or the absorption, or something is going on, because we're seeing here there's no increase in nitrites. And although that's at salivary levels. So I don't know what's going on here, but clearly consumption of folic acid plus nitrates does not seem to interact very well. Like you'll eventually see an increase in nitrates, but it takes much longer. And we see that ultimately indicates that there doesn't seem to be much of an effect in systolic blood pressure measurements, and certainly none when looking at diastolic blood pressure measurements. And yet we also see that even when nitrite levels are quite high, nitrate levels are at their highest at the 60-day mark, we don't see a drop in blood pressure. Now, if you were to look at this, I would not look at this and say, oh yeah, definitely there's no effect. I mean, if you're going from this to this, I think that they're probably getting close to an effect. It's maybe approaching statistical significance, but for some reason, one reason or another, they did not end up reaching statistical significance. But I can't say that there's an effect. I don't know. Like I'm not looking at the stats. I can't look at the stats. I can't look at the data. So the only thing that we know is that only at the 30-day mark, there was a drop in systolic blood pressure. And then at the 60-day mark, it just didn't exist anymore. But you can still see that this is markedly lower than this, even if the statistics don't indicate that there's a difference. So something wonky is going on here. I don't know if it's the statistics. This is these if these are error bars, these are pretty massive error bars. So I'm not sure what's going on here. But then looking at the systolic blood pressure, looking at the ambulatory, so before it was just clinical, this is the ambulatory over the 24 hours, we do see at the 60-day mark, we do see that there's an effect. So it may be the time that they measured it for the clinical that they don't see an effect. Maybe they measured it too early in the morning or too late in the afternoon or whatever it might be. Something was going on. But here we see a little bit more consistent effect with the nitrate consumption. At the 60-day mark only, they do see a drop in systolic blood pressure. A little wonky compared to the other. Diastolic blood pressure, there seems to be a drop only when they're taking the nitrate and not when they're nitrate plus folate. Not sure what's going on there. And then here we're looking at the daytime values. So daytime, and we're seeing again that there is this drop in systolic blood pressure and diastolic blood pressure as well. And then the nighttime values. So again, this data would corroborate the previous studies data that was looking at ambulatory and separated them out and saw no effect at night and did see an effect during the day. So this effect is driven, the 24-hour effect is driven more by daytime values than it is by nighttime values. So this study, just like the other one, is a little wonky. I mean, we have to take it for what it is, but I'm glad that we're looking at a number of studies so that we can look at the trend in the data as opposed to just relying on this study and the previous study as our holy grails of do nitrates work. Okay, study 130. This is the last one before we get to our conclusions. So this is a meta-analysis of all the studies that we've already gone over, but this is more powerful because you're adding statistical rigor to the pooled data across all the studies that we looked at. So instead of looking at them individually and saying, okay, largely they seem to point this direction, this allows us to group all the data together, normalize the data, and apply statistics to the aggregate of the data, the total of the data. And just realized I have so I'm using my hands like to indicate, and you can't even see what I'm pointing out. So it's grouping all the data from the 7 studies and then pooling all that data together from all the participants. So now we're going to be talking about hundreds of participants, and then it applies statistical methods to that data specifically to find if there's an overall effect. And how they do that is they go through a identification process, a screening process, and then they include the studies. So they ended up identifying 326 studies. Then they screened 216 of them after they removed duplicates and things like that. And then they ended up eliminating, animal studies and other, like they didn't use the right type of nitrates or whatever it might be, like a bunch of different things, or they weren't randomized controlled trials or whatever it might be. So they end up removing 79 for that, and then they go through a secondary screening and remove 50 because of, like I said, they used pregnant women, they used nitrates, including other like vegetables. They did blinded interventions. They mixed the nitrates with drugs or whatever it might be, and they ended up with only 7 of these studies. And what I mean by drugs is it'd be like nitrates plus, some specific drug, whatever it might be, some blood pressure lowering drug or some statin or something along those lines. Like it's fine if they separate it out where you have these groupings of these drugs, but it's different when you're specifically trying to find out if the nitrate alone has an effect. If you obviously add another component to that, then that changes things. And I'll bet you for this analysis, they just eliminate, because they do include the folic acid study, but they're probably not going to be including the folic acid arm or condition in their study analysis, because that would be the addition of folic acid plus nitrate. So they're just going to be looking at the placebo versus the nitrate condition. So that's how they go about the actual like picking out the studies and whatnot. And this is usually done by multiple researchers independently, and then they come together and determine like which studies belong together. And here we've got a Cochrane review. So here they're looking for potential bias. If you see green, that indicates that there's low risk of bias. If it's yellow, then there's a potential, a moderate risk or an unknown risk of bias. And red, there is a high risk of bias. That doesn't mean that there technically is bias. It just means that there's a potential risk of bias. So we've got all the studies listed here by the first author name, and then they've got the different qualifiers that they end up looking at. So if they're looking at for like if they do concealment of the allocation, so if like for example you'd be looking at things like randomization, you'd be looking at things like a placebo, making sure that everybody's blinded in the study so that you don't, not literally blinded, you don't like cut out their eyes or anything, but you make sure that the researchers don't know what everybody's condition is, and and the individuals don't know what condition that they're in. So those kinds of things are the things that they're controlling for across these conditions. And you can see that none of them were perfect. This one, the Ciervo study, was probably the best. Overall, it had a pretty good result, had moderate potential bias here. And the Bondono study was pretty good as well. I'd say the Gilchrist and Kapil study seemed to have probably the most amount of potential bias. But in total, what were the effects? Do we corroborate some of the effects that we've seen? So here again, they're separating it out by clinical, so a single blood pressure measurement at the clinic, or ambulatory or 24-hour study. So not all the studies use 24 hours, not all the studies used clinical, so that therefore they have to separate it out accordingly. So here they've got the list of names for all the studies, right? Here they've got the values that the studies indicated. So the mean, so in the nitrate condition and the placebo condition, the standard deviation or the overall variance in the result, the total number of individuals that they have listed here, and then they do the same thing for the placebo, the means or the average, the standard deviation, which is the variance, and then they have the overall effect. If you were to compare, if you were to subtract the nitrate condition results from the placebo condition results, what is the overall effect? What is the mean difference between the two? And then the weight that they put on the study. The way they determine the weight is how many participants are involved, as well as potentially like the blinding and things of that nature, and how much of a standard deviation, how much standard error do you have within the study, like things like that. I'm not going to bog down this conversation with a ton of details on all that stuff, because that would take like a whole nother half an hour to 45 minutes. And this is already going to be super, super long. So the weight just determines essentially, you can think of it like the amount of confidence that the researchers have, or the results have behind them. So the greater the weight, the more that it has an influence on the overall effect. So like this study, the Bio study, has a weight of 1.5%, which is minuscule, which means that the strength of that study, the power of that study to have an impact on the overall effect, which is this black diamond, is very low. The reason for that is because they have 5 individuals in each condition. And on top of that, the standard deviation is absolutely massive. And that's why, even though it's in favor of nitrates, the standard deviation is massive. So it could be, anywhere within this within this confidence interval, I should say. But the reason why they have such a wide confidence interval is because the standard deviations are so wide. So that's why they reduce the value of that study to the very lowest. The strongest study is this study, at least in this grouping of studies, is 11.6. So the Capil study, probably because they had the most individuals. They had 32 individuals in each condition. And therefore, the effect that they see, the confidence is much greater. Therefore, the confidence interval is much smaller. It's a weird way to describe that. So hopefully that's somewhat clear. If it's not, honestly, it's tough for me to go over all this data and then to also try to teach statistics on to look at data analysis. It's a little too difficult. So you're just gonna have to take my word for it. Certainly look up this stuff. Make sure to check after me. That's perfectly fine. Then they've got heterogeneity tests. So they're looking at, for example, like the I-squared test, which indicates the amount of inter-study heterogeneity. So how much of a difference between studies is there? And there seems to be a moderate amount of heterogeneity, which we can see that, like this study compared to this study compared to this study, they don't seem to be quite exactly perfectly aligned. Okay, that all said, what we're most interested in is, and they did use a random effects analysis, which is great. That's what they should have done. We're looking at the overall effects diamond. Is it more towards the left? Then it favors nitrate supplementation. If it's more to the right, then that means it's more placebo supplementation, or meaning that nitrates do not have an effect. And we see here that there is an effect. With a p-value of 0.05, there is an effect when looking at the clinical data. Now, all of this also applies to the ambulatory data. And here we see that the p-value is 0.08. I would argue that's probably just because they don't have enough studies. They don't have enough strength, power in their analysis, and that's why they didn't see a statistical effect. But I would argue this is probably statistically significant as well. You are certainly welcome to disagree. And then in totality, when they're looking at both together, there seems to be that there is also an effect here as well. So the test for the overall effect is 0.01. So, and there is no subgroup differences, so statistical significant differences. So if you were to compare this group versus this group, are there differences? No. So this again adds some credence to this idea that this is probably statistically significant. That would not be enough on its own, but it at least offers some details that these are not different, and this one shows a strong effect, and this one is indicating that there might be an effect. Most likely they are truly not different, and there really is a benefit of nitrates. So that data that we just went over is on systolic blood pressure. This is looking at diastolic blood pressure. And here things become far, far less certain. Matter of fact, none of this is statistically significant. So yes, we see the black diamond is starting to move towards nitrates, but it's just not a powerful enough effect. They need more data, especially as you get to smaller and smaller effect sizes. The statistical effect, the statistical power that you have to have, the number of studies that you have to have has to be pretty extreme, has to be pretty high. So you need, let's say, double the number of studies to be able to actually tease out a statistical effect. And here we see that they just don't have enough. And I would argue that the effect size is so negligible, it's like 2 or 3 millimeters of mercury, that it's probably not going to be much above like noise. So that's why they don't find any difference here, or the combination, they also see no difference. Yes. And then study 134, which I forgot that I'd skipped this for a specific reason. So this is specifically in people with type 2 diabetes. I'm going to label this as preliminary data because I only have one study on the topic. And I think that considering we've gone over so many other studies in hypertensive individuals that do not have diabetes, and there we can get some more conclusive results. But in this, I'm just going to report the data, and we'll say it's preliminary data. That does not actually mean that this necessarily applies. If we were to look at 5 more studies would this conclusion end up being accurate. So it was public funding. Study 134, 27 men and women, 67 years of age, overweight, type 2 diabetic, obviously, and they were on diabetes medicine. This was randomized, double-blind, 8 weeks with a 4-week washout. So it is crossover. So people were on the nitrates for 4 weeks. Then they washed out for, or I guess they were on it for 2 weeks. Then they washed out for 4 weeks. And then they were on placebo, which was dextrin in this situation. So not the same solution with nitrates removed, but straight up dextrin. And they wanted to know if there was going to be any sort of difference after the 8 weeks. So here again, we're looking at the baseline values. So age 67, duration of diabetes about 13 years. Their blood pressure was 142, so quite high. Diastolic was 81. BMI, they were severely overweight, and obviously they were diabetic. You can look at some of these other mechanisms as well. They also seem to be on anti-hypertensive, so it does seem like they were taking medication for that as well. On average, 2 of them. Then looking at the nitrate levels, we see that there is an increase. Again, they're doing the same thing that they did in that one study way back when we first started this video, where they looked at, where they were comparing or created that line between them. So everybody seemed to increase in their plasma nitrate levels when they were consuming nitrates. And then when we look at this, which looks, it says nitrates as well, but they made a mistake. They actually wrote it in their legend as nitrite. So this is nitrite and this is nitrate. Blood values. Again, not great that researchers would miss this kind of stuff, because it's pretty basic stuff to just make sure that everything looks and is written out correctly. Again, it just shows that they're not really paying attention to the details. I'm just going to leave it at that. So ultimately, they also don't show any statistics on this, and they don't indicate like the average results. I believe, my understanding is that these were statistically significant. Obviously, this one is because everything is moving upwards, and largely all of these are increasing, although the effect is certainly smaller. So they don't actually show the bars or anything like that, which I would like to see like they did in the other study, but they didn't indicate it. But yes, there is an increase in at least plasma nitrate levels with the consumption of the nitrate. Okay, so then look at the actual blood pressure. We've got placebo, systolic, and the active. So active is the treatment condition, and there does not seem to be an effect. Placebo diastolic and active diastolic, no effect. And mean arterial pressure, again, no effect. Now, that could be because they're on antihypertensives. That's a possibility. Or it could be because they're diabetes. Another possibility. Who knows? This study is not altogether awe-inspiring in terms of its confidence building. But the results, at least as it stands here with these preliminary results, which we would need a lot more data, it indicates that nitrates do not seem to help in type 2 diabetes, reducing the blood pressure specifically. Okay, wow, that was a lot. We've been at this for quite some time, and if you're listening, if you're watching the insider's version of this, then you're going to get access to the correct dosing to achieve these results, the blood pressure results, as well the effects on diabetic blood sugar, as well as some other health effects, as well as a weird thing that if you something to avoid doing so that you don't negate some of the effects that we'll go over in this conclusion. But for those of you that are just sticking around for the public version, here are the conclusions. So beetroot, or specifically the effect of nitrate supplementation, reduces systolic blood pressure, but does not seem to reduce diastolic blood pressure. We saw a few studies where there was a slight decrease, but in totality, once the data was all pooled together, we did not see that effect. So that was because the effect is so tiny. In hypertensive individuals with a greater emphasis on unmedicated hypertension. So people that were medicated, some studies showed no effect, some studies showed an effect. But it was pretty consistent in anybody that was unmedicated with hypertension. But the effect size is pretty small. So in certain, as we saw, like there's some variability, like some individuals saw a plummet in their blood pressure, which is great. They saw like a 10 or 15 millimeters of mercury drop in blood pressure. But on average, it was 4 to 5 millimeters per mercury. And as I mentioned, if you're interested in learning about the exact dosing that you should be using, that you should consider using, the effect on diabetes, specifically other measures like blood sugar and other health effects, then I would certainly welcome you to join me with the Physionic Insiders program, where you get access to this and much, much more. Whew, that was a lot. Yeah, thanks for sticking it out, and I'll hope to speak with you in the near future. Have a good one. Bye.